You've heard of PCOS, you've heard of IVF, you've even heard of IUI, but have you heard of Asherman syndrome? Hi, welcome to Health and Wellness with Dr. Happiness. I am Dr. Happiness, your trusted guide in family health and wellness. In today's video, I will tell you everything that you need to know about Asherman syndrome. It is a hidden cause of infertility in women. It is a cause of infertility that's less talked about. In fact, most times doctors don't even think about it. What is Asherman syndrome? Asherman syndrome is also known as uterine synechia or uterine adhesions. Asherman syndrome is a condition where the uterine endometrium, the inner lining of the uterus, is filled with scar tissues, making it impossible for the fertilized egg or embryo to implant in the uterus and grow. What are the causes of Asherman syndrome? Asherman syndrome results from surgery in the process of trying to remove uterine polyps or fibroid. It can also result from excessive curettage during dilatation and curettage or D&C. It can also result from after delivery, a placental tissue is retained and maybe not picked up. Infection crops up, and when it heals, it leaves a scar. Asherman syndrome varies in severity. It can be mild, moderate, or severe. Mild could just be a strand of scar tissue extending from one edge of the uterine endometrium to the other. Severe could be when it's much more than that and occupying almost the whole uterus, while moderate is just like half of the uterus. How do you know, or what are the symptoms you see to know that you have Asherman syndrome? If you have ever done curettage or endometrial surgery, uterine surgery, and then your menstrual flow used to be 3 to 4 days before, maybe 3 days heavy flow, the last day light, and suddenly after all these causes I have mentioned, you start seeing your menses 1 or 2 days and then with pains at times. Suspect Asherman syndrome. Are Asherman syndrome treatable? The good answer is yes. Fortunately, it can be treated, and unfortunately, it can recur. How do you diagnose Asherman syndrome? Asherman syndrome is diagnosed in the hospital, and the best diagnostic procedure is through hysteroscope. That's hysteroscopy, when you look into the uterus using a fiber optic object or equipment called a hysteroscope. When you look into the uterus and then you see scar tissues, that's diagnostic. Other forms could be through hysterosalpingogram, where a dye is put into the uterus and then is captured using X-ray. Another one is hysterosonogram, where a salty liquid is instilled into the uterus and a scan is used. So you can use X-ray or scan, or by just visualizing. What are the treatment options? The treatment option you have is surgery too. So surgery can cause it, and surgery is used to treat it. The hysteroscopy, when you use it to diagnose it, can also be used to treat it by cutting out the scar tissues. So the treatment is by removing the scar tissues through surgery, and then the woman is placed on estrogen. Balloon is passed to maintain the patency of the inside of the uterus. That balloon is removed in about 4 to 5 days. It is important to come for follow-up with your doctor. Asherman syndrome can recur, and that is the bad part of it. You can get pregnant after treatment of Asherman syndrome, but it can recur, and the recurrence rate is high. So it is important you monitor your menstrual flow. If it is not following the right pattern, the normal pattern, go and complain so that it can be checked out, especially if you have issue with infertility. They could be the hidden cause. Asherman syndrome can be the hidden cause of your infertility, and you will not know except you go get checked out, except you go get tested. If you have found value in this video, I think it's the right thing to like it and to subscribe. Share it with women with infertility. It might be a solution to their problem. Asherman syndrome is real and is not as uncommon as you think. So, let's do the right thing. Go check out with your doctor. If you have done all the investigations and all of them come out normal, think of Asherman syndrome. It could be the hidden cause of your infertility. Remember, together, let's build healthier and happier families. I am your doctor, Dr. Happiness.